can you tell us more about STI PrEP and if we might see it available soon?
STI PrEP, well, somebody is definitely at the cutting edge of science. So STI PrEP is definitely a new idea and somewhat controversial, perhaps. The goal really is to acknowledge that our rates of gonorrhea and chlamydia and even syphilis have just continued to climb steadily over the last few years. And we have to ask ourselves, are there other interventions that can reduce people's risk of infection the same as we can do for HIV? And we have data from a very big study in France that looked at taking a very common antibiotic, which is called doxycycline, and it showed that if you took it as PEP, so post-exposure prophylaxis, you had sex and then took the medication, it had a very big reduction in the risk for chlamydia and syphilis infections. People have argued to say, well, we don't know what the long-term effect in terms of maybe resistance or other things would be from taking antibiotics that way. So there's probably a lot more steps of evaluation that we're going to go for before it becomes a routine thing. But as you know, we've done a study in the city with Dr. Troy Grennan at the BC CDC looking at tolerability and acceptability of using this type of strategy for preventing chlamydia and syphilis. And the first pilot part of it, just looking to see how people did with the medications, was very well tolerated. We saw hardly any infections in people using that as a strategy. So my personal hope is, as we gather more scientific data, this might become one of the more routine things that will be integrated as an option for people that have struggled with infections in the past. The other thing that's being evaluated, and I think will be very exciting to see where it goes, is there is some evidence that a vaccination which is designed to protect people against meningitis might actually offer some coverage for gonorrhea infections as well. And that's being studied now in a very large study to see if that will hold up. So I think the next few years hopefully will bring a lot of options for STI PEP or PrEP. And I think this is definitely something that we want to be at the forefront of, given what we've done with HIV, just added to our repertoire of prevention services for people. So I think that's, let's keep checking in on that topic.